Hey guys, Pharmacist Geek here. This is the first video in my over-the-counter series where we discuss a condition which can be treated within a community pharmacy and try and give you an overview what questions you can ask, differential diagnosis, red flag symptoms, that sort of thing. If you like this type of content, be sure to let me know down below, leave a comment, make sure you subscribe. Let's jump straight into the video. I'm using multiple resources for this video. The main one is Paul Rutter's Community Pharmacy. I'll leave a link down below, you can go check it out. So a lady walks into the pharmacy, looking noticeably anxious, walks up to the counter, blushing a little bit. Hi, I'm suffering with a little problem down below. So what are we thinking first of all? Offer the patient if they would like to speak in private or somewhere quieter. It's good to say that you have multiple questions you need to ask. These questions can be personal and embarrassing, occasion where patients don't want to speak in private, but they don't actually realise that you're going to ask them questions. So something along the lines of like, hi, not a problem at all. Shall we go somewhere more private as I have a few questions I need to go through with you. So with that, you've fully set the expectation of the patient. Now the aim is try to ensure there are no red flags and rule out differential diagnoses. So we start by asking the patient what their symptoms are. They inform you that they have a slight discharge. In terms of vaginal discharge, there are three main conditions: bacterial vaginosis, thrush, and trichomoniasis. However, only thrush can be treated OTC in a community pharmacy. Let's discuss the similarities and differences between them, and this will help you rule out certain differentials and help you come to a conclusion of what the patient is suffering with. Let's start with odour. So is there any odour to the discharge? So thrush has little to no odour, and if there was a strong odour present, then the patient would need to be referred. The same would be true if there was a fishy odour. The patient would also need to be referred. We can then move on to colour of the discharge. Trichomoniasis can have a green to yellow sort of frothy discharge. Bacterial vaginosis usually is a sort of grey to whitish. And then thrush will be described as like cottage cheese-like, curd-like. So already you can see how we can quite easily narrow down what we think the diagnosis should be. Also, is there any itching present? Thrush is associated with the most itching, whereas the other two, there'll be minimal to no itching present. We can distinguish if there's any pain present. Anything more than soreness may require referral. And we need to remember, guys, constantly challenge the diagnosis. Don't go in there thinking it's definitely this, it's definitely that, because all you're going to do is potentially cause harm to the patient. Moving on though. So medicines like antibiotics, corticosteroids, drugs which affect estrogen levels can increase the likelihood of thrush. So that's something to bear in mind. Useful to ask a patient if they've been on a course of these drugs recently. We need to rule out if a patient is diabetic. If so, referral is needed, as it can indicate poorly controlled diabetes, and then hypoglycemia can make it more difficult to eliminate thrush. Is the patient pregnant or breastfeeding? The treatments are safe, but should be prescribed by a doctor or midwife if the patient is pregnant. If a patient has recurrent thrush, which is 4 or more episodes in a year, referral is also needed, as there might be underlying causes like undiagnosed diabetes. Also, the age of the patient is important. OTC products aren't licensed for under 16s or over 60s, which is because thrush is less likely in these age groups. So now we have ruled that the condition is likely to be thrush, and there are no referral criteria present. We need to know if it is internal or external, and this will help us to select the correct product for the patient. So far we have discussed the most important factors to consider when a patient presents with thrush. A separate video will cover the treatments. Subscribe to make sure you stay up to date with my content. Thanks for watching. I've been Pharmacist Geek. I'll see you in the next one. Peace!